Welcome back. November or Movember is a month dedicated to raising awareness of men's health issues, from mental well-being to testicular and prostate cancer. Prostate cancer in particular remains one of the leading cancers among men worldwide. Joining us to shed more light on this is Dr. FIRDAUS DAHLAN, family medicine specialist whose subspeciality is in sexual and reproductive health in primary care. Thanks for joining us, Doc. Now, to begin, could you explain what prostate cancer is and why it has become such a major health concern for men worldwide?
Okay, good afternoon, ELANE. Thank you, BERNAMA, for having me here. So, two big words you mentioned just now. Prostate is a male reproductive gland located just beneath the bladder and surrounding the male urinary tract. So, its main function is to produce fluid that makes a significant portion of semen. On the other hand, cancer is a condition which is characterized by uncontrolled growth of abnormal cells, eventually leading to form a mass known as tumor. So when we combine these words together, it can be a very harmful situation, especially among aging male, causing diverse symptoms as well as reduction in quality of life. So in terms of globally, we know that prostate cancer is the fourth most common cancer in the world, and also second most common among men. So estimated roughly about 1.5 million are being newly detected each year. And there are many robust studies and strong evidence in regards with prostate scanning. If we screen early, we detect early, we can greatly improve the prognosis because it is fairly treatable.
Now, Doc, tell me, how common is prostate cancer in Malaysia, and what trends are you seeing in terms of the awareness of early detection, as you were mentioning earlier, which is important among Malaysian men?
So, according to the Malaysia National Cancer Registry, prostate cancer is the third most cancer in men. So after colorectal cancer and lung cancer. So the lifetime risk is about 1 in 83 for Malaysian men, and we are seeing increment number of the prevalence. So for the past 10 years as compared to maybe 50 years ago, we have seen increase in terms of awareness among Malaysian men. I strongly believe this foundation is built up by multiple stakeholders, effort to elevate in terms of health literacy, organizing health campaigns, having men's health services, especially in private or in the government setting, as well as having accessible information. I think good job for BERNAMA for calling me here to educate all the men out there. So, however, there are still men out there who have this knowledge below par. Malaysian men are still unaware of prostate cancer symptoms and signs and the importance of having prostate cancer screening. So unfortunately, most of our patients, especially Malaysian men, they presented late. 2/3 of Malaysian men, diagnosed at later stage, which makes earlier detection and awareness crucial in this scenario.
Now, I think this brings to light this very important question. What are the typical warning signs that should prompt a man to visit a urologist, and why is this early detection so important in improving these outcomes?
So to begin with, prostate cancer can be very tricky. So as it does not just read the textbook and follow all the clinical signs, because those who presented early, especially stage 1 and stage 2, they are asymptomatic. They have no symptoms at all. So that's the beauty and the importance of screening early. So when a person who has signs and symptoms, especially symptoms suggesting of prostate enlargement, these are the ones we need to diagnose, investigate early. So for example, increased frequency of micturition, especially nighttime, and called as nocturia. You have a slower urinary stream, pain during micturition, having blood in semen as well as in the urine, unexplained weight loss, erectile dysfunction, lower limb numbness, and muscle weakness. And if the cancer cells has spread to the backbone, the person can have, all this back pain. So far, we know that early detection saves lives, improve quality of life, improve survival rate, and having more treatment option. And the most important part is cost effect, which reduces healthcare burden not just to patient but as well as to Ministry of Health.
Now, Doc, perhaps you can let us know, at what age should men consider getting tested, and what are the current global recommendations for screening, and what's the frequency?
So based on global guideline for a person with average risk, the prostate screening begins at early as 50 to 55 up to 69 years old, or person with life expectancy beyond 10 years. Those who have at higher risk, for example, having, a family history of degree of relative having prostate cancer, or with having an African ancestry, these are the ones we need to capture as early as 40 to 45 years old. However, I would like to emphasize here is all about shared decision making between the treating doctor, and also the patient. Means that the clinician should talk about pros and cons, what to do next if it's increased, what to do next. So there are two basically things that we do. First, we call it as digital rectal examination, as simple as using the finger to palpate for any abnormalities or irregularities, as well as sending for PSA testing, what we call as prostate specific test antigen test, tumor marker testing, by performing just a simple test. So it's not a perfect test. That's why you have to see a doctor, because PSA level can spike in many occasions, such as not just prostate cancer, but also benign prostate hypertrophy. You have your prostatitis, urinary tract infection, and etc. So those who, a PSA level beyond 4 may need to see a urologist for MRI or even a biopsy.
So that's something that they need to put into their schedule. Now, there's still, of course, a lot of hesitation and stigma when it comes to prostate exams. How can we encourage men across cultures to overcome that fear, Doc?
So I think the first thing, the most important thing, to address the idea, concern and expectation of the person. So especially when we talk about men's health, not just prostate cancer, when we talk about sexual dysfunction, is all about, separating the myth from the fact and vice versa. So knowing Malaysian men, they do love, listening to their friends, their healers, from all these unreliable sources, rather than going to the healthcare workers, or even have a chat with the prostate cancer survivor. So the fear can be reduced only by education. Empower them with knowledge and information, so that they can, just as simple as explaining about the procedure. It takes like merely 5 seconds and it's painless, and also highlight the risk versus benefit. So another thing that I always do at my clinic, so just give time to patient. Try to gel with the patient. Try to, make patient comfortable. If patient, does not agree during the first visit, you can arrange during the subsequent visits. So another point is, we do understand, Malaysia's culture where privacy or modesty is a key. So gender match providers can be very helpful in certain scenarios. Requests by patient or offering male healthcare providers may be reduce reluctance, fear, and also shyness among our gentlemen.
Now, Doc, I love how you brought up this point, hearsay versus facts. Let's get educated so that we know what we are dealing with. Now, next, how do lifestyle factors such as diet, smoking, or perhaps physical activity influence prostate cancer risk across different regions or populations?
So as they said, gene loads the gun, but lifestyle pulls the trigger. So Western diet consists of high saturated fat, red meat, and processed meat. These are heavily linked to high prostate cancer risk and aggressiveness. So based on the previous study, it has shown that increased prostate up to 19%. And if you look, good news for those who love to eat vegetables and fruits, especially tomatoes consist of high lycopenes, may confer protection against the aggressive prostate cancer. And smoking is a bad habit. Everyone knows about it. So it can be harmful not just for your cardiovascular system, but as well as for the prostate health. Smokers have 20 to 30% higher risk of dying of prostate cancer, and more likely to have aggressive or recurrent disease. So smoking increases inflammation, oxidative stress, may disrupt the hormonal level, and also can be the fuel for cancer growth. So another component that we always talk about is exercise. So what does moderate exercise means? So you have to exercise at least 150 minutes per week. 2, vigorous physical activities has shown reduction of prostate cancer death, and also reduces obesity-related inflammation. So while genetics and age remains a non-modifiable, diet, smoking, exercise, these are within our control. So adopting a balanced and also healthy lifestyle, all proven ways to prevent prostate cancer and also to improve long-term outcomes no matter where we live.
Now, finally, as Movember shines a light on men's health, what's your message to men around the world about being proactive and prioritizing regular health checks?
So, Movember isn't just about, growing your mustache. It's about growing awareness as well as being proactive. So, screening isn't just about embarrassment. prioritizing regular health checkup is not just showing your weakness or vulnerabilities. It's about empowerment. So remember, real strength is about being proactive. Means that taking health as an important asset, protecting your health and also your loved one. So my message is to men everywhere is simple. 4 things. You remember, don't wait, talk to your doctor, get screened and know your numbers. Take these small steps here today, not just for yourself, but also for your loved ones, for your family, for your community, and those who depend on you.
Thank you so much, Doc. That was amazing. We were speaking to Dr. Adam FIRDAUS, DAHLAN family medicine specialist, on raising awareness of men's health issues. Now, more global updates in just a moment. This is The World on BERNAMA TV. Stay tuned.